There are multiple screening modalities. With a colonoscopy, that is the only modality that's going to allow you for diagnostic and therapeutic treatment. And what I mean by that is diagnostic, we put the scope up, we see the polyp, and now we can actually remove the polyp. So that is the one thing that it's a one-stop shop. So, Cologuard, when you do the get, go, gone, that's all wonderful and fine. However, if there is a false positive, guess what? You're still going to have you're still going to get referred for a colonoscopy. If you do those fecal occult blood tests, which are good, I mean, it's still helpful that you do them every year. You will find a colon cancer, but the problem is if you're taking certain medications, it can give you a false positive. If you're taking certain, like aspirin, if you're taking certain foods, like we all love beets, it's going to make it turn red. That's something that could give you a false positive. Even if you have a polyp or a cancer, it doesn't bleed all the time. So you can have a false negative test where you actually have a polyp, you actually have a cancer, but it's just not bleeding at that time. Now, there is a CT colonography where you can have a CT scan picture.
And is that the virtual colonoscopy that I heard? Okay, good. I was going to ask that.
Now, the problem with the virtual colonoscopy is sometimes patients don't clean out as well as they should. So there's still a little bit of residual stool. And if there's still a little residual stool, that can look like a polyp on a virtual colonoscopy. So guess what you're doing? You're cleaning out again, and you're going to go have a colonoscopy. As long as you're screened, that's what matters.